Handling eye drops can prove to be quite challenging, especially when you're doing it alone. Whether you've been prescribed specific eye drops by your optometrist or you've purchased over-the-counter tears or allergy drops, many individuals find this task daunting. But worry not. I've compiled some valuable tips to help you apply eye drops with ease and safety. Let's get started. Let's delve deeper into Tipashtu 1, which is a highly effective method to enhance your eye drop application experience. By refrigerating your eye drops, you introduce a game-changing element that adds a whole new dimension to the process. Picture this. As you instill the chilled drop into your eye, you'll not only experience the immediate relief of refreshing coolness, but also the heightened awareness of the drop's presence. Gone are the doubts and uncertainties of whether you manage to get the drop in your eye or not. The icy touch leaves no room for ambiguity. This simple yet transformative step instills a sense of assurance and satisfaction, making the whole procedure much more manageable, especially for those who find administering eye drops a daunting task. Moreover, refrigerating your eye drops offers a range of additional benefits that make this practice even more rewarding. If you happen to suffer from dry eyes, the cooling sensation of the chilled drop can provide much-needed relief and soothing comfort. Likewise, for individuals sensitive to eye drops that may cause a burning sensation, the low temperature of the refrigerated drops acts as a soothing balm, alleviating any potential discomfort. This small adjustment to your eye care routine can make a significant difference in your overall eye health management, promoting more pleasant and hassle-free experience when tending to your eye's well-being. So, remember to embrace the power of refrigeration for your eye drops and indulge in the refreshing sensation it brings, while ensuring a smooth and worry-free application process. Your eyes will thank you for this simple yet invaluable tip. Now, let's move on to Tipashtu, an equally essential aspect of successful eye drop application. This tip revolves around the proper use of your dominant hand to handle the eye drop bottle or vial. When dealing with these small containers, a certain level of finger or hand strength is required to extract the drop effectively. To ensure a smooth delivery, it's crucial to exert sufficient pressure on the bottle or vial while holding it with your dominant hand. By doing so, you guarantee that the drop is released precisely and in the right amount. To further enhance the precision of the process, establish a stable foundation by resting your dominant hand on your non-dominant hand. Your non-dominant hand should be gently pulling down on your lower eyelid, effectively opening your eye and creating a clear path for the drop. This two-handed approach provides stability and control, minimizing the risk of missing your target and ensuring the drop lands accurately in your eye. Keeping a clean environment for your eye drop administration is equally crucial. A hygienic setting not only prevents potential contamination of the eye drop solution, but also fosters a sense of confidence and trust in the overall process. So, be sure to follow this indispensable tip and witness the positive impact it has on the precision and success of your eye drop application. For Tipashtu 3, we focus on 3 critical aspects to ensure the utmost hygiene and safety during the eye drop application process. Firstly, before handling the eye drop bottle or vial, make it a priority to wash your hands thoroughly with soap and water. This simple yet crucial step significantly reduces the risk of introducing any harmful bacteria or contaminants to your delicate eye area, promoting a sterile environment for the application. Secondly, when you unscrew the cap of the eye drop bottle, ensure you place it on a clean towel or tissue. This prevents any potential surface-to-surface contamination and maintains the integrity of the eye drop solution. By utilizing a clean and designated spot for the cap, you eliminate any worries about dirt or germs compromising the contents of the bottle. Lastly, exercise great caution to avoid direct contact between your eye and the dropper tip. Touching the dropper tip to your eye could introduce bacteria from your eye into the bottle, increasing the risk of eye infection or other complications. Instead, hold the dropper slightly above your eye and let the drop fall gently onto the targeted area. Tipashtu 4. Achieving optimal eye medication absorption requires a careful approach. When applying eye drops, Consider this essential tip. Use only one drop at a time. The human eye possesses a limited capacity to hold fluid, approximately 10 microliters. In contrast, the average eye drop contains 50 microliters, which far exceeds the eye's capacity. As a result, a significant portion of the medication often spills out and lands on our cheeks after applying the drop. By using a single drop, you can maximize the effectiveness of the medication. Multiple drops not only prove wasteful but also lessen the overall impact of the treatment. Therefore, to ensure proper absorption and minimize wastage, remember the importance of a precise, one-drop application. Tip #5. Proper technique for eye drop application. For optimal results when applying eye drops, follow this crucial tip. After instilling the drops, gently close your eyes and apply slight pressure to the inner corners of your eyelids using your fingers. To ensure the effectiveness of the eye drops, it is essential to avoid excessive blinking, especially considering the presence of small openings known as puncta on the inner lower and upper eyelids. These puncta function like sink drains, allowing excess tears to drain from our eyes and enter our nasal passages, where they are eventually absorbed into our bloodstream. This step is particularly crucial when using medications with systemic side effects, such as steroid eye drops and glaucoma medication. By applying gentle pressure to the drainage system, you can enhance the absorption of the medication and minimize any potential side effects. So, remember to close your eyes, apply gentle pressure, and avoid excessive blinking for the most effective eye drop application. Let's delve into 3 simple and effective methods for applying eye drops. To begin with, employ a mirror for the first technique. Slightly tilt your head upward and direct the bottle dropper precisely into the pocket formed between the lower eyelid and the white portion of the eye. Utilize your dominant hand to administer the eye drop and your non-dominant hand to gently lower the lower eyelid. This ensures proper placement and precision when applying the drops. Moving on to the second method, this one works best when you're lying down. Begin by placing the bottle or vial on your nose bridge, positioning the dropper's tip within your field of view. Gently squeeze the bottle, allowing the medication to flow smoothly into your eye. The horizontal position facilitates an easy and accurate application, making it a convenient option for administering eye drops. The final tip is a personal favorite and one that I often use myself. To begin, place a drop or 2 of the medication in the inner corner of your eyelid. After that, open your eyes and blink, allowing the eye drop to disperse naturally. This method proves particularly beneficial for children or individuals who might feel uneasy about applying drops directly onto their eyes. With these handy tips and tricks, I hope you find the process of administering eye drops much more manageable and comfortable. Feel free to share your own techniques or tips in the comments section below. I appreciate your support, so remember to like and subscribe to my channel for more helpful content. Stay tuned for my upcoming video, and I look forward to seeing you there.